Good afternoon. This is Dr. Craig Stern at Pharma Pharmaceutical Consultants and ProData Analytics. We're delighted to have a few minutes to talk to you today. Want to talk about a couple of topics I think that are coming up in the news, and we thought that it might be interesting to attack these problems from a different direction. One is that a celebrity, Ben Stiller, talked about the fact that he used a PSA test, or a prostate-specific antigen test, and that it saved his life. So I want to talk a little bit about testing and what that means. And then the second thing I want to talk about is micromanagement and macromanagement of data. These things seem to keep coming up, and I think that fundamental issues are useful for us to understand a little bit more about what they mean. Let's talk first about testing. One of the biases in healthcare is that people in general, healthcare professionals in general, want a number, whether it's a number of blood pressure or a number of blood sugar, or it's a number that has to deal with liver disease or kidney disease or something. Effectively, you want a number. And it's relatively nice because you have one number that you can refer to and say, okay, this number is high or it's low or otherwise. What you really have to understand is that in many cases, and more as time goes on, we're dealing with cases where one number is not enough. We need multiple numbers in order to identify what the real issues are and whether someone has a particular problem. In the case of somebody who's testing prostate in elderly men to identify whether they have a prostate problem, we're dealing with whether they have an infection or whether there's been trauma or perhaps cancer, and you can't do that with one number. And the fundamental issue is really one of data. It's also one of data analytics and of math, and that is when you do a test has two very broad ways of identifying whether that test is giving you the results that you want. Number one is the test specific? Meaning, does it specifically tell you that someone has a particular problem or doesn't? It's called specificity, and you're trying to identify how many false positives are there. If you're doing it, perhaps that you're actually treating someone for a disease like PSA, and you're saying, okay, it had a rise and it went from 2 to 4, 6, or 8, and so you're dealing with something that may be cancer. In fact, it may be something else. The important thing is specificity tells you whether something is very specific to a problem or not. In the case of PSA, it's a very broad specificity, so in general, it cannot just be used in order to deal with whether it's cancer, an infection, or otherwise. The other part of it is sensitivity, and that is, how sensitive is it? If you have a very little bit of a problem, does it identify that problem? If you have a lot of that problem, does it identify it? Clearly, when you're dealing with sensitivity, you'd like it to be as sensitive as possible, so that what you're looking at and what you're seeing is something that is very specific to the problem. For example, if PSA had particular numbers that dealt with infection, you'd know that an elevation of PSA was due to an infection, not to cancer. And also, similarly, if there was an issue with regard to cancer, the particular numbers would be there. It doesn't invalidate something. It just identifies that literally every test that we do, whether it's a blood test or a genomic test or any other test, that you're looking to see how specific is it to the particular condition that you're treating and how sensitive it is to it. You don't have to be an expert in math. You don't have to be an expert in testing or otherwise, but it is important to know, okay, I may want to use it, and maybe it isn't a very sensitive test like a PSA, and it may not be part of the national guidelines for using it, and then you have a choice. You may want to use it because you want a lot of different numbers, a lot of different information in order to make a decision, or not. And obviously there's differences with regard to how much do tests cost, how often time do you run it, how much valuable information is there in the process, and things like that. So on a general way, we want to know what's going on with our numbers because that helps us to make decisions, but it also helps us to understand that a test may be very good because it's very sensitive and it's very specific, or the wider it is that it's a particular problem. So when we hear about it, it's not bad news, it's good news, but at the same time, if we're going to use it and we're going to make decisions, we want to know how specific it is. And the fundamental questions that anyone can ask is, how specific is this for my particular concern? And how sensitive is it? Do I have to have a little bit or do I have to have a lot? Let me move to another topic that comes up all the time. And we are data analysts. We've been doing it a very long time, and we are scientists and mathematicians, and so it helps us to deal with all of these things, especially on the part of purchasers and payers that have a lot of decisions to make and management with regard to the data that they use. But fundamentally, we're also addressing fundamentally, what are we measuring? Is it a micromanagement of a problem or a macromanagement of a problem? If I deal with macromanagement, I'm looking at an entire healthcare benefit, or I'm looking at a population of people and saying that they have a particular disease, and is one group doing better than another? Is one group more severe in their disease than another? But I also have the issue that I may want to micromanage some things. I may be very concerned about opiates, or I may be very concerned about the use of opiates and other depressant type of drugs. And in doing that, I'm not managing the entire thing. There's nothing wrong either way with what we're talking about. What we're trying to do is to understand, what is it that I'm managing? What am I trying to do? If my focus, for example, is entirely on compliance and compliance with drugs, which is a good thing. You want people to be able to deal with whether they have complied with their medications, then you're looking at compliance. Now, that may not help with regard to whether they're taking the right medications, whether they in fact have duplicate medications or otherwise. What we're dealing with is the fact that they are complying with the medication. Not a bad thing, it's a good thing, but we're micromanaging on compliance. Similarly, another issue comes up with regard to outcomes. Outcomes are either one, compliance with medications or compliance with particular guidelines. Are they getting the therapy that is standard national guideline for treating a particular disease? You may also be looking at the number of hospital admits, emergency room admits, the avoidable hospital admits, etc. And you're looking at that and saying, okay, people are getting better or getting worse because they have less hospital stays, less ER stays, less avoidable hospital stays, better compliance. So things can go up, things can go down, but you're looking at a very specific area, and that's micromanagement. When you're dealing with macromanagement, you're dealing with not just what was done, but what was the outcome of it, and looking at the entire spectrum of things. For example, suppose that we're treating a group of people who have metabolic syndrome. They have diabetes, they have hyperlipidemia, high lipids, they also have hypertension, and you're looking at an entire population and you're saying, I'm looking at the population, there's an average for that population, but as I look at different parts of the population, some of them are doing better and some of them are doing worse. I have to be able to divide that population up. Some of it has to deal with compliance, meaning severity of disease and how severe they are, and that's a very important indicator because I don't want to mix people who are really sick with those that are just in a maintenance mode that aren't that sick. But I also have the situation where I want to take a look and see, why is one group doing better than another, and I'm looking at all of the parameters to deal with it. That is part of this kind of confusion that goes on where we talk about big data. Big data is interesting if you know what it means, and most people, including me, are frequently questioning, what are you talking about? But big data means that you're putting sensors on everything, and as a result of that, you are getting a huge amount of data as to how people are responding and what they're doing with regard to different medical indicators, clinical indicators, behavioral indicators, etc. Well, that sounds good, and it may be good, but the reality of it is it also adds a significant amount of noise into the process. Some of that information is useful, some of it is just maintenance, and some of it doesn't mean anything. And so as you look at it, you need to decide, am I doing a macro management? I'm looking at everything. I'm trying to address what's going on. Or I'm looking at micro, and I just want to know, has the compliance gone up with drug therapy? Have hospital visits gone down, ER visits gone down, etc.? These are general analytical issues that we look at all the time. There are issues that you address with regard to overall analytics, but I think it's important for all of us to understand that as we get into what's going on with issues of therapy and how people and how populations are working, that we understand more about what all this means, because at the end of the day, science is about the questions that we ask, not about the answers. If we ask the right questions, then the answers have meaning. If we ask general questions, the answers have no meaning whatsoever. We'll talk again in next week, as we have been doing at around noontime on Wednesdays. Please feel free to keep your interest going with our daily, hourly changes in what's going on in the news. Feel free to click on www.profarmaconsultants.com/rxinfox.html, and feel free to keep up with what's going on with the stocks of healthcare, as well as what's going on with the news in healthcare from different dimensions. We look forward to speaking with you again. Have an outstanding rest of week.